interdisciplinary education and collaboration. When we say interdisciplinary education, the members of interdisciplinary integrate their disciplines and collaborate with one another. Interdisciplinary education occurs when students from two or more professions learn about, from, and each other to enable effective collaboration and improve health outcomes. Increasing complexity in our society requires interdisciplinary interventions. Trends in social problems and professional practice make it virtually impossible to serve clients without collaborating with professionals from various disciplines. Interdisciplinary collaboration is essential when addressing complicated social issues, and well-designed interdisciplinary education prepares students to work on interdisciplinary teams. Here are the obstacles to achieving interdisciplinary education. First, the negative perceptions and attitudes about interdisciplinary education and collaboration impact effective collaboration. Lack of knowledge of others' roles, perceived differences in status and expertise, and negative stereotypes. There is a limited consensus about how and when interdisciplinary skills are taught within social work programs, leaving a great deal to the discretion of the individual programs. Omitting curriculum about interdisciplinary collaboration can leave social work students at a loss when placed on interdisciplinary team post-graduation. If social work education neglects to implement interdisciplinary learning opportunities, students may not be able to use the common language used by students from other majors who have participated in these opportunities. How to enhance effective interdisciplinary team collaboration. Interdisciplinary teams can learn to create new goals and reflect on the process. It is critical that undergraduate students, specifically social work students, are prepared to work in interdisciplinary teams and to understand these key concepts related to interdisciplinary team function. All students should have school with an understanding of how to best work on an interdisciplinary team. Preparing students affords students an opportunity to tackle complex social issues. Here are the five things that can positively affect interdisciplinary collaboration. First is interdependence. It occurs when professionals acknowledge that they need the entire team to accomplish the established goal. Next, newly created professional activities. It includes programming and services that are made available because of the collaboration and would not be possible if individuals from different professions were working alone. Flexibility, with professionals and interdisciplinary teams being called on to compromise and be inventive in order to achieve their goals. Collective ownership of goals. It requires team members to work together to establish a shared goal and determine how, as a team, the goal will be reached. Reflection in the process. It occurs when team members take the time to consider the process and think about how it could be improved. Here are the things that can positively or negatively influence the process of interdisciplinary collaboration. Structural characteristics. It can enhance or inhibit interdisciplinary collaboration. Professional role. It is critical that professionals have a clear understanding of their role as well as their scope of practice. Personal characteristics. It can influence the ways in which people interact with others on a team and the quality of relationships they form. History of collaboration. It refers to one's prior experience working on interdisciplinary teams and whether that experience is perceived as positive, negative, or neutral. Interprofessional education collaborative. Identified four competencies. First, work with individuals of other professions to maintain a climate of mutual respect and shared values. This is the values or ethics for interprofessional practice. Use the knowledge of one's own role and those of those other professions to appropriately assess Another is the healthcare needs of patients and to promote and advance the health populations. This is the roles or responsibilities. Third, communicate with patients, families, communities, and professionals in health and other fields in a responsive and responsible manner that supports a team approach to the promotion and the maintenance of health and the prevention and treatment of disease. This is the interprofessional communication. Fourth, apply relationship building values and the principles of team dynamics to perform effectively in the different team roles, to plan, deliver, and evaluate patient or population centered care and population health programs and policies that are safe, timely, efficient, effective, and equitable. This is the teams and teamworks. Thank you.